So doctor, let's go through this. I guess we should start left to right.
Sure. The first image, the one that says normal airway, obviously is the image of a normal airway. That's what the airway of a normal individual looks like, or in a person that has very mild asthma that is not having an exacerbation. The middle image, the one labeled asthmatic, you can see already that dark red layer that has the dots around it. It's much thicker than it is in the other, and that's also so for the other layers. If you compare the image on the left to the one in the center, every layer is thicker than the other one. Mm-hmm. And finally, when you see the last one on the right, you see that there's been extreme narrowing of the lumen. So the amount of air that can get through there is less than a third of what it is in a normal airway.
And we know there are varying degrees. In that picture that we were seeing, doctor, is that a pretty severe attack right there?
Yes.
Would you consider that to be pretty bad?
That would be an attack that would place the patient in the hospital for sure.
And this can, I mean, be life-threatening, right?
Absolutely.
For many people.
For many people, and one of the worst aspects of this is that this occurs in many young people that are very active in school and sports. And when you see in the news a young man that's playing high school football that just basically passes out in the middle of the field, and
it's awful.
And that oftentimes this is the cause, that they're exceeding their limits and not recognizing that they're having an asthma attack and not treating it appropriately.
How can someone help if they witness something, not the football player obviously, but if you see someone who is having an attack, what can one do to help them, besides call 911, of course?
Well, calling 911 would be the first and most important aspect of assisting them, but to ask them if they have an inhaler with them to help them, an emergency inhaler to help at least alleviate the symptoms somewhat until professional help is available.